Hey friends, this is Washington State, and we only have a couple of months to enjoy the sun and get outside and have fun. If pain is keeping you from getting out there, it's time to fix that. Washington's summers are the most beautiful time of year here, and we live in the most beautiful state. If you live here, you know that for 9 months, we kind of deal with the dreary, gloomy, dreary, all of that stuff, because the summers here are truly magnificent. And everybody wants to get outside and go hiking and work in their garden and do all of the fun things that we get to do during the summer here. And it is such a bummer when you start having pain right at the beginning of the summer. In fact, we've had a lot of people calling the clinic recently because they got outside and started doing yard work, and guess what? Their back hurts, their hip hurts, their knee hurts, which means then they can't do the biking and the hiking and the kayaking and all the fun things that we get to do. Time is short, and it's time to take action now. I'm Dr. Amy, and we are empowering women with changing bodies to move pain-free. I hold a PhD in Orthopedic manual physical therapy, and my goal today is to help you get outside and enjoy all that summer fun. What are the most common injuries that I see during the summer? Mainly, I see sprains and strains. I see more sprains like when people go out hiking and they misstep, or there's a slippery rock, or there's a slippery dock when you're getting in the boat. A lot of them occurring in the ankle or the knee. So how do you manage a sprain? Well, in general, for the first 48 hours, you do want to take it easy. You want to unload that tissue. You can elevate it if you want to. You want to be icing it. Some people like compression. I'm kind of 50-50 on the compression. You see, compression can be helpful to keep the area from swelling, and if it swells up super quick, you may need some compression to help manage that. However, we don't want to limit the body's natural ability to heal. So you may want to have some compression, like a compression sock or something like that, when you're up and walking around, if it's your ankle, or even a compression sleeve if it's your knee. However, when you're resting, you want to take that compression off so your body actually has a chance to heal that area. You definitely do want to be icing, because those sprains can swell up pretty quick. In fact, I recommend 5 minutes every hour that you are able to. And what do you do after the first 48 hours? Well, you want to gently return to activity as your body tolerates. Now, what does that mean? As your body tolerates means it's not increasing the inflammation to do the activity, and it's not increasing your pain to do the activity. That as you're doing the activity, you're getting more motion. So let's say you sprain your ankle or your knee and you take a couple days off, you feel like the inflammation is going down and it's getting better, but every time you get up to walk, your ankle or your knee just blows up and gets really inflamed. Then what you're going to want to do is you're going to want to do short bursts of walking, maybe just walking around the house. Then you got to sit back down and put some ice on it. Because this initial stage is all about managing the swelling and the inflammation. Too much swelling and inflammation will keep the body from healing. But yes, swelling and inflammation is a normal part of the process. So we're not trying to eliminate the whole thing, but we don't want it to get overwhelmed with so much swelling and inflammation that the body can't actually heal. Because too much swelling can lead to stagnation. And if it's stagnated, it can't actually heal. Now, strains are different because those are generally overuse or maybe not getting warmed up before you do your activity. So this is like shoulder tension after the first time you go paddleboarding because it's a beautiful day and you went out for longer than you probably should because you haven't done that all winter. Or a sore back because you went out into the yard and you only meant to do just this little bit of activity and you ended up being out there all day. Because when the weather's nice, we want to get outside and do all the things. So if you're suffering with a strain, what you want to do is take it a little bit easy the next day, but you want to keep moving because the tissues need that movement in order to be able to heal. So gentle stretching is okay in this case. You definitely want to use some ice to manage your symptoms, but you want to get back to moving earlier than the sprains because your body needs that gentle movement in order to be able to heal. And I do want to caution you with some warning signs that you should not ignore. Any pain that gets worse with movement, you should not ignore, and you should stop that activity and ice. Any swelling that doesn't go down when you're resting is definitely concerning. Any instability or weakness in the joint where you feel like you just can't walk or do your normal movements is concerning, because that is going to potentially lead to increased swelling and pain. And the truth of the matter is, if you can't move pain-free, or at least without your pain increasing, then please don't do it. I get this question a lot, especially with people who have sciatica, because anytime they move, they have pain. Anytime they sit, they have pain. Anytime they're laying down, they have pain. So if they try to walk or move, of course they're going to have pain. So saying to wait until there's no pain, like they'll be waiting forever. So what we're looking for is that your pain does not increase. As long as it does not increase, you're okay to continue. But as soon as it's increasing, you need to go rest for a few minutes. When do you need to get help for an injury? Anytime you find that your issue is not healing on its own. Now, here's my concern with that. You need to wait a day or two to see how your body is responding, because a sprain or a strain is going to be really painful at first, and it should taper off over the next couple of days. But if after 3 to 4 days, you're not noticing a change in your symptoms. Now, I'm not saying that your symptoms will be totally gone, but you're not noticing any change in your symptoms, I would recommend you seek help at that point, because the longer you wait to seek help, the longer it's going to take to actually fix that issue. If you feel like after 3 to 4 days, you're having to rely on pain medication or muscle relaxers in order to be able to move or sleep, then you definitely want to seek help from a manual physical therapist to get some tools to help you be able to recover faster without medication. We can also help you with preventative techniques to avoid re-injury while you're healing, because that's the worst, when you start to get better and then you re-injure yourself. Some people just need help dealing with the inflammation. Their body is doing what it's supposed to do, but it just keeps getting really inflamed. So we definitely have options for that if that's what you're seeking. That's actually what I did. I used our regenerative technology because I was healing from a lateral ankle sprain, and I'm also in the middle of training for a race. And so I needed to get healed up as quickly as possible. The challenge is that I stand on my feet for 10 hours a day. So every day I was basically kind of re-injuring myself without the chance to do what my body needed. Enter regenerative medicine. That's what helped me be able to heal so I could get back to my training schedule. Or you may need help because you need to heal quicker because you've got a vacation or some important event coming up. So we had a patient who ended up spraining her knee while she was hiking, and she had a vacation coming up in 10 days. So obviously, when you have a sprained knee, it's very difficult to walk on the beach in the sand. And if that's what your whole vacation is about, you definitely want to get healed up as quickly as possible. So our goal for her treatment was to limit the inflammation and improve the stability in her knee so her body was actually able to heal. We also had another patient who recently came to us just a few weeks before she was leaving for a European vacation, and she had strained her hip and was having a lot of pain with walking, which, what do you do all around Europe? You walk. And so we used a combination of physical therapy and regenerative medicine to help get her prepared for her vacation. At Physical Therapy for Everybody, we want to support the fastest return to activity possible. It is much easier to deal with a sprain or strain when we get the chance to see it within the first couple days or the first week. Now, yes, there are some people who have been dealing with this issue for years who we end up treating. However, the truth of the matter is that is going to take longer to heal because there's more layers of the onion that have to be dealt with in that healing process. So if you have a recent sprain or strain or injury or just a new pain that has started, I encourage you to seek help right away, because the sooner you do, the sooner you'll be feeling better and getting back to doing all the things that you love doing and enjoying our beautiful Washington summer. I encourage you not to wait it out on your own. If you're dealing with pain, get in touch so we can get you back outside. If you're located in the Maple Valley, Washington area, I would love to offer you a free discovery visit where you can learn more about how we get people back outside doing the things they love. If not, we do offer online health coaching. If you'd like to learn more about that, feel free to drop an email to concierge@pt4, that's the number 4, eb.com. And before you go, don't forget to like and subscribe, and I'd love for you to comment with your favorite Washington activity.